Hey guys, in this video I'll go in details about post-finasteride syndrome and recovery, how to fix post-finasteride syndrome, how to fix post-Lyons-Man syndrome, how to fix PSSD, uh, PAS, so post-Accutane syndrome. Okay, I will cover a lot in this video, so stay in the end because you will not get this information anywhere. Okay, so a lot of this information are coming from my work with clients. Okay, so I see many blood tests, I see guys improving, so I prefer natural way. I see also other guys using uh, chemical and all these kind of things. I use it also, but not to great extent. Okay, so I will give you a lot of tips. Even natural cure is possible. Okay, fully natural cure. And what credibility do I have for this? Okay, so my father is a medical doctor. I work with clients for several years, like to help them with TRT, get off the TRT, to improve general health and so on. I was personally hit by all these kind of things. Okay, so Palmetto syndrome, I took Palmetto for years, finasteride, ketoconazole, minoxidil, I blocked DHT, 5-alpha reductase. Okay, so I I started with the thing that I fix myself. Okay, so my testosterone was around 150, so my DHT was completely blocked. I spent years with severe anxiety, panic attacks, brain fog, depression, all that kind of things. Okay, so it's hard to describe everything, but all is possible to fix mood, to fix everything. Okay, so guy, be patient, and there is a cure. Okay, so PFS, PAS, PSSD, okay, post-Lyons-Man syndrome, all these have some kind of similarities. Okay, there are some differences also. There are not two PFS clients. Okay, so like one client has only problems with DHT, and the second client has really huge problems with like inflammation, sleep, uh, fatigue, gut health, and cognition and anxiety, depression. Okay, so some guys only have problem with ED and libido and so on, and other client is completely different, has several of these symptoms. Okay, so what's the main problem with Lyons-Man, PFS, post-finasteride syndrome, post-Palmetto syndrome, PSSD? Okay, so the problem is with androgen receptors. In PFS, it's mostly overexpression or low PFS or low androgen receptors. Okay, it depends. The problem is with 5-alpha reductase. Okay, because dutasteride, finasteride, Palmetto, they all affect 5-alpha reductase. Okay, so dutasteride, the effect is like 95% because they affect both 5-alpha reductase enzymes. Okay, so finasteride is less potent, but less potent means like 70%. Okay, so still extremely potent. Yeah, so at least you have some chance that your body will convert DHT from testosterone and other neurosteroids. Okay, this is another issue with many guys. Neurosteroids, okay, like allopregnanolone, pregnanolone, progesterone, and so on, because these things are important for your sexual health, but also for your mental health. Okay, allopregnanolone is GABAergic and so on and so on. Okay, so we also need these neurosteroids for sexual health and also for our cognition and so on, like talking and so on. Yeah, so there are also other things connected with PFS, PAS, and all this kind of syndromes. Okay, so inflammation, insomnia, low DHT. Okay, guys, three main things. Okay, androgen receptors. Why? Because of the DHT. DHT is modulation of androgen receptors. Okay, testosterone itself is not that great. It can also have effect on androgen receptors, okay, but not to that great extent as DHT. Okay, DHT is the most effective androgen receptors modulator. Okay, so in these cases, DHT is mostly low. Androgens are low due to blocking 5-alpha reductase. Okay, so and because of the block DHT, there is also effect on on androgen receptors, because this is body response to low androgens, so body creates some kind of overexpression. Okay, so and this overexpression leads also to things like alpha 1 androgenic receptor. So this alpha 1 adrenergic receptors has really great influence on your prostate health, on vascular effect, and smooth muscle. Okay, DHT why so many guys have, for example, ED, okay, on PFS, PAS, PSSD. Okay, so there are effect, for example, in blocking alpha 1 adrenergic receptors and DHT. DHT has effect on nitric oxide, okay, and smooth muscle, and the same alpha 1 adrenergic receptors has effect on vascularity, smooth muscles, okay, and smooth muscle and smooth muscle contraction. Okay, so we need to fix this. Okay, so for example, that's the reason why trazodone is so effective at helping with ED in PFS, PAS, post Lyons-Main guys, because, or PSSD, because it will help with alpha 1 adrenergic receptor. Okay, so but it's also be possible by upregulating DHT. Okay, so alpha 1 adrenergic receptor is only step further. Okay, but I always tell that you need to fix root cause. Okay, so why I would, for example, one thing, okay, in PFS, many these gurus are using DHB. Okay, so it's a metabolite of progesterone. Okay, so and progesterone will create this missing allopregnanolone, because we have three main things: 5-alpha reductase, allopregnanolone, androgen receptors, and for DHT. Okay, but DHT is an upregulator or modulator of androgen receptors. Okay, and if I want to increase allopregnanolone, okay, I don't need DHB. I can use allopregnanolone directly, or I can cure the root cause, and the root cause is 5-alpha reductase. Okay, without 5-alpha reductase, I'm not able to convert testosterone and all these kind of things to neurosteroids. Okay, so so low DHT will cause low nitric oxide in penile tissue, also will have effect on androgen receptors, smooth muscle, and will create fibrosis. Okay, so guys, even some guys will fix their PFS, PAS, and so on, but PSSD, but they still have, for example, ED or erectile dysfunction. Why is it so? Because they have fibrotic tissue in their penile tissue. Okay, so how you can fix? Watch till the end, I will tell you. Okay, so what is the solution? Okay, the first thing, you need to detox this shit. Okay, and it takes some time. Dutasteride, it can take up to 5 months. Okay, finasteride is much easier, few weeks, but it depends. Okay, so if you are using 5-alpha reductase blockers, okay, that have also effect on one enzyme that is able to metabolize finasteride and, for example, dutasteride, you will prolong this process, okay? Therefore, some guys still have maybe some small amounts of this medication in their blood, okay, so, or in their body generally, okay, so we need strong liver to detox these things, okay, so supplementation like taurine, okay, will be helpful, and for example, calcium D-glucarate will help to detox these metabolites, okay, so at the beginning we need to detox everything, okay, so or you can wait quite a lot, okay, and you can create a lot of issue because your androgen will be affected, 5-alpha reductase will be affected, everything, because you have still this in your bloodstream, okay, in your body, so it will affect, even if you stop, it will affect your body. And even worst thing is if you stop, have a break, and you will start again, okay, and many guys have relapses only because they are using 5-alpha reductase inhibitors or blockers, okay. So I had one client and he had a really big crash, and I asked him, and he told me that he made a food with a lot of black pepper, okay, and black pepper is pretty well known for its ability to block 5-alpha reductase, okay. So we have also things like AGCG, rosemary, ketoconazole, curcumin, green tea, saw palmetto, pigeon, beta-sitosterol, okay, they all are blocking 5-alpha reductase. So if you don't want to crash during recovery, you try to avoid everything, okay, so from this, for example, okay. So solution, we need to increase DHT, or okay, the first thing is 5-alpha reductase, okay. Regarding 5-alpha reductase, we have several ways we need to do, okay. So prolactin, take a look at your prolactin. High prolactin will cause decrease in 5-alpha reductase, okay. Many guys pass PFS, saw palmetto, they have high prolactin, okay, so this need to be fixed, and you will also have more 5-alpha reductase, okay. So DHT, okay, there are several ways how you can increase, okay. You can increase naturally with tribulus. I have many clients with success on tribulus, okay, but you need to have enough testosterone, or maybe some middle range of DHEA, because the tribulus will work by increasing DHEA, DHT, and also can lower prolactin, okay. So tribulus is really great, but you should have at least some level of testosterone and maybe DHEA, okay. So there are several ways how you can build or convert more DHT. Testosterone, if you have high testosterone, then you need to help to increase 5-alpha reductase. Then you have also DHEA, how you can convert more DHT, okay. So also you have synthetic possibilities like proviron, okay. Proviron should be taken with HCG and or with testosterone, okay, TRT, yeah. So if you need help, you will find a link in the description for my coaching. I can support you on your way to fix all these kind of things, okay. So supplementation that can help on the way, okay. So supplementation that help with NAD plus or NADP plus, okay. So things like magnesium, B complex, and supplementation that increase NDA plus, because NDA plus will increase 5-alpha reductase, and this is the most crucial thing, okay, because 5-alpha reductase is also involved in neurosteroids, okay, in allopregnanolone and everything. We want to fix the root cause, okay. There are other things, okay, like Valproate, Vornostat, and all these kind of things that that for example Valproate is GABAergic. I think the most beneficial part in Valproate come from GABAergic properties, but it's only replacement for Allopregnanolone. Okay, so if you fix Allopregnanolone, you don't need things like Valproate. Okay, so yeah, there is some anecdotal evidence that Valproate is a HDAC inhibitor. Okay, so it can have some effect on epigenetic changes. Okay, so can alter gene expression, but honestly there are also natural ways how you can do this. Okay, so for example butyrate, yeah. There are also other things, but the other things are also 5-alpha reductase blockers, so I will not recommend them. Okay, so also garlic extract, extremely great working on HDAC. Okay, so but for example tribulus has really great effect on androgen receptors in modulating androgen receptors, so you don't need always to start with fixed light of Valproate, because Valproate has many side effects. Okay, so I would rather start with tribulus, with glycine, and all these kind of things. They works. Okay, so and NAD plus. Okay, so guys, I forgot to mention that you need blood test. Okay, so you can do blood test, and you really need to have this huge panel with progesterone, pregnenolone. You need to have total testosterone, free testosterone, DHT, because you need to know these conversions. Okay, so how much of testosterone will convert to DHT if your testosterone is low, high, estradiol, prolactin, because I already told you prolactin will affect 5-alpha reductase. Okay, and you can also do Dutch test to see. You need to have the whole overview. Okay, like progesterone, pregnenolone, sometimes even you can test even allopregnanolone. Okay, so another supplement that has been used a lot recently by biohackers, okay, is DHB. Okay, it's metabolite of progesterone. Okay, so and it's precursor to allopregnanolone. Okay, so we are talking about the same thing again. Okay, so the problem, many people thinks that they will change something, they will make some epigenetic changes, but the root cause is androgen receptors, and this can be affected by restoring DHT, restoring 5-alpha reductase, and if you restore 5-alpha reductase, you will restore neurotron steroids. Okay, like allopregnanolone. Okay, so that's the root cause, guys. So we need to understand some logic. Okay, so DHB, okay, is used by these biohackers, but what's even better, it's supplementing with allopregnanolone. Okay, so I am not telling it's easy, because it's harder to get. Okay, so it's harder to get, but there are even studies of using allopregnanolone for Alzheimer and all these kind of things. It can have restorative effect on your brain. Okay, so it's really great, for example, to have allopregnanolone, or if you are not able to supplement with allopregnanolone, progesterone is good to supplement, but also you need to restore 5-alpha reductase, because you will restore normal PET. Okay, so next thing, why so many guys have ED even if they fix their PFS, PAS, and all these kind of things, is because of the fibrosis. Okay, fibrosis. They have also a prostate issue. I already told you it's because of the alpha-1 receptor, and you can make a grayscale ultrasound, and if the urologist is experienced, he will tell you if you have this fibrotic tissue. Okay, many guys, even young guys, have fibrotic tissue. Okay, can you reverse it? Of course you can. If you need my help, you will find a link for the coaching in the description. But what are the possibilities? Okay, like Cialis. Okay, at least you have some not nitric oxide, but blood flow to your penis. Great thing. I talk about this in many videos. Pycnogenol. There are even studies, okay, studies that pycnogenol help to reverse fibrotic tissue in your penile tissue. Okay, so proviron will do because it will increase DHT. DHT has effect on smooth muscles. Okay, so the less DHT, the more problems with your erection and all these kind of things, because it will increase nitric oxide, it will decrease fibrotic tissue, and so on. Catuaba or catuama supplementation will help. Okay, so there are studies that you have so many natural things that can help. You don't need to go after complex chemical substances in order to fix your issues. Okay, so also shockwave therapy, but we are not talking about radial shockwave therapy, but on focus with specific devices. I can help you with recommendation. You will find the link in the description. Pentoxetylene is also medication that can be used for fibrosis. Okay, so sometimes guys need TRT, HCG, because, for example, they have low testosterone, and even maybe something is not working and you want to increase DHT. Probably you will not do monotherapy with proviron, okay, if you need it. Okay, I would always start with tribulus with specific cycles, but for example, if you need it, okay, older guys, for example, need combination TRT, HCG, and proviron, like we are talking 35 plus, but younger guys would be good with, for example, HCG and proviron. I don't recommend clomiphene, okay, so for this, but rather HCG plus proviron, okay, because proviron will increase DHT. Okay, always start small. I see doctors, they recommend huge dosage, and then you have a problem. Okay, there is another supplement that also have been used recently. It's a peptide, Livagen or Livagen, I don't know how to say it. If it's necessary, honestly, I don't know. You have also, it can help. It can help because it can do cellular repair. Okay, so it can also be neuroprotective and can improve cognition and liver function. Okay, we want to detoxify the shit, so it can help. Okay, so I think it's not completely necessary. You need to just increase your liver health. So guys, help me promote this video, so comment under this video. Okay, so we move the algorithm, and if you have some question, ask in the comment section. Guys, hope you like this video. Give the like button, and see you.